Very good evening all. So this is Dr. Hari Kiran. I am consultant interventional cardiologist at Srikara Hospital's Kompally branch. Right now I've been asked by many patients that how about these sudden cardiac arrests in case of gym. So while they are working out, they have sudden episode of collapse, and finally when the doctor declares that he is dead because of sudden cardiac arrest, many of the patients, they are worried whether to go for a workout or whether to consult a cardiologist or some physician before going for a workout. See, if our advice is that generally most of the patients, they can go for moderate physical activities and moderate kind of exercises, like whatever you do in the gym with minimal or moderate weightlifting or some kind of strenuous exercise, moderate kind of exercise, it is fine. But if you are going for strenuous or heavy workouts, generally you need to see if you have any family history, like if your siblings or your parents or grandparents have suffered any kind of heart attacks or sudden collapse, like they don't have any complaints, all of a sudden when they are moving outwards or when they are moving outside or when they are asleep, suddenly they were found dead. So if there is any such history, you should always get your workup done. And patients who are already diabetics since long and who have uncontrolled sugars, and these people are at risk of silent myocardial infarction, like you call it silent heart attacks. So because their nerve endings are damaged and they don't perceive any pain even if they have some ongoing heart attack. So these people can have a sudden heart attack when you have when you go for a strenuous exercise. So generally few patients, like 1 in 1000 or 1 in 1 lakh, can have some genetical problems leading to cardiac muscle dysfunctions. Cardiac muscle dysfunctions or cardiac electrical disturbances, they are called as cardiomyopathies or channelopathies. So people with these different genetical abnormalities may succumb to sudden cardiac arrest, or they may suffer a sudden cardiac arrest during an episode of sudden strain or sudden emotional outburst. So in order to know whether you have such kind of disorder or not, generally there are some screening methods like basic ECG or some 2D echo, where you can identify some syndromes called Brugada syndrome or some kind of hypertrophic cardiomyopathies, where these people will have increased susceptibility to have a episode of sudden cardiac arrest when compared to normal individuals. So people with hypertrophic cardiomyopathy are 1 in 500 in number. Generally 1% out of 500 common people will have this hypertrophic cardiomyopathy, and this hypertrophic cardiomyopathy can at times lead to sudden cardiac arrest because of ventricular tachycardia or ventricular fibrillation. They are nothing but heart beats almost 200 to 250 to 300 times suddenly per minute, and then all of a sudden it can stop. So these are the things, or these are the risk factors which you need to get screened before going for a heavy workout. And after this basic screening, generally your physician or your cardiologist may advise you to undergo further tests if your basic screening has some abnormalities. Further tests may be treadmill test, where you have a graded strenuous activity where you are supposed to run on a treadmill for 3 minutes at a lower speed, and then your speed keeps on increasing for every 3 minutes, and finally if your heart is able to tolerate severe workload, it indicates that you may not be suffering any kind of further episodes during the strenuous workout. So with these tests, generally they can give you an assurance that okay, you can go for a strenuous gym workout. But rest assured, no one can assure you, guarantee that you may be having some kind of, you may not be having any kind of abnormalities. Few people, 1 in 1 lakh or 1 in 10 lakhs, may have some rare genetic abnormalities, and even after this basic screening, still there may be chances of sudden cardiac arrest. But you don't need to worry about all those things, because 1 in 1 lakh or 1 in 1 crore is very rare. So you can go for a moderate workout without any kind of screening, and if you are planning for a heavy workout, then you should go for some basic screening with your cardiologist, and then once the cardiologist assures you that okay, you can go for a strenuous workout after basic screening, you can do that. Okay, thank you.